Good evening and welcome everyone. I want to especially welcome you to the Preventive Care Webinar 6.0. I'm very excited that you are here this evening. I want to welcome you and welcome you once again. So right now that you are here, what you're going to do is to take the link that brought you here, share it out to your friends, share it to your enemies, share it to your neighbor, share it to everyone. They have to be on here tonight because we're exploring a very interesting topic that concerns everybody. It concerns everybody, and it's a sensitive issue that people don't really talk about, but it's a very important one. Please, if you can hear me, put in the comments that you can hear me. Just put in the comments that you can hear me loud and clear. If you can hear me, put in the comments, say I can hear you, I can hear you, so that I'll be sure that you can hear me loud and clear so that we can get going. All right, it's already 11 minutes past 7, and we are delving right into it. Welcome once again. If you can hear me, put in the comments that you can hear me. All right, so as usual, we're going to be starting by refreshing our minds about preventive care and what preventive care is all about before we get to the niche of what we are talking about today. So what exactly is preventive care? Just like we've been defining it, and we've been talking about it. Basically, preventive care are those actions you take to prevent diseases from occurring or prevent diseases that are already there from deteriorating, from getting worse. This is the simple definition of preventive care. And we've also understood that 70% of the diseases that caused the 70% of deaths last year were caused as a result of non-communicable diseases. These are things that are non-communicable. These are things that could have been prevented. These are things that could have that lifestyle changes could have modified. These are things that could have been averted. But because the way people live, because of bad health habits, these things really caused havoc. This caused a lot of deaths last year. And when I say 70%, I'm talking about 43 million deaths, right? So that's a lot of deaths worldwide, and these are the recorded ones. So it is important that you take charge of your health and be proactive about it. Preventive care is about you being proactive about your health. Preventive care is about you taking charge. You're not waiting for things to happen before you start taking action. You're not waiting for things to go bad before you start giving attention to your health. No, you are not doing that. You are taking charge of your health, making sure that you are giving quality attention to your health before things happen, to ensure that your health is in complete balance. Your health is top notch, right? So with that in mind, we're going to be delving into what we have. So you understand that preventive care is something that you should practice. It's something that you should incorporate into your life. It's something that you should encourage your loved ones, your parents, your friends, even your enemies to practice. It is something important. It is something very necessary. And because of that, we're going to be looking at preventive care concerning sexual health. We're going to be looking at that tonight. And we have a very special guest who's going to be talking about this. And before I bring him on, I'd just like to give an intro of this subject of sexual health. Some time ago, during the month, we're in a new month, and happy new month, by the way. Sometime during last month, which we just exited, we did a Q&A session, and we discovered that a lot of people are actually struggling with sexual health issues, probably STDs, infections, or just a lot of things. And the questions were just so much, and the concerns were so much that we decided, okay, let's have a session on sexual health because we really care about you. We really care about you who is in our community, and would like you to make the most of your health. So that's why we're bringing on this guest today to talk about it. And brace up, because we're going to be unearthing so many myths and also so many things that you need to take note of to protect your sexual health. And the reason why this is very important is because This is not even about those sleeping around. This is not just if you're sleeping around. This is about you. If you are a person, there are some things that you may be doing or may not be doing, or ignoring, or giving so much attention to, that may be harming your sexual health. Right. So we're going to be understanding the concept of sexual health, what it really is, and how to go about it. All right. So at this point, before bring on our guest for today, put out this link again, put it on your status, forward it to groups, and then get more people on here as we get started. All right, so without further ado, we are bringing on our guest for today, Nurse Collins. Now, before I get on, Nurse Collins, I've seen him teach in several platforms, and because of the way I saw him taught, we thought it would be very necessary to bring him on because of the way he teaches with passion, and he's very knowledgeable at what he does. So we are bringing him on to get started on this. So please put your virtual hands together as we bring on Dr. Nurse Collins on board. Please put your virtual hands together. Nurse Collins, you have the floor.
Confirm if you can hear me, please.
Yes, I think I can hear you.
Okay.
All right. Welcome to the Preventive Care webinar, Nurse Collins. You are very much welcome.
All right. Thank you so much.
Thank you so much.
Those notes. I want to say that thank you for being here or being here. I'll be very honest. In fact, you can see right now, I'm still currently. So can you hear me, please? Can you guys hear me?
Yes, we can hear you. We can hear you.
Okay, can you hear me?
Okay, can you hear me, right? Yeah, we can hear you.
Okay, I just wanted to confirm. You can see right now. I must make sure that I, attend and do this today. So forgive me for the background. I'm in the hospital. Anyway, so we'll just dive in straight up into what we have today. Sexual health. Sexual health is one thing that people they don't like to talk about it, and the truth is, I get pain when they don't talk about it. Sexual health is something that we should be proud about. Is During the course of our lecture today, you are going to find out that it's not just about sex alone. There are other things that encompasses that make sexual health sexual health. I'll be defining it. I'll be doing so many things today. In fact, I made my lecture so simple that without me even saying anything, by just reading my slides, you'll be able to like find one or two and then place together. It's very easy. I just made the slide out of the book I'm writing, which will be out soon. So without no further ado, let's just go straight up into our class today. I would love for you to make some comments. So I know that you're following. I love to see that people are following. Just before that, let me quickly call on our host for today. Mr. Prosper, can you please come up? Okay, I just want to ask, how do I do a follow-up on that section?
I didn't know what you said. Can you repeat what you said?
I want to know how
All right. I think they'll be probably dropping comments or their questions, and then we'll have the WhatsApp community. Most of them will drop their questions there, and then I'm going to take it from there, and then I can be asking you the questions from here.
Okay. Agnes, okay, quickly, I'll just go in now.
Thank you.
I'm trying to bring up my screen. Just so they lead to. Confirm if you can see my screen. My slide showing on your end? Can you guys see my slide? Okay, thank you. All right then, thank you. So we are going to be talking about sexual health. Now, because of today's class, I don't want it to be so boring. We are going to be talking about sexual health. um, Basically, you're talking about the essentials. We are not going to be going too deep into it. We are talking about the essentials. So securing your sexual health for life. How do you intend to secure your sexual health for life? We'll be doing that one after the other. Now, in my course of lecture, I'll be talking about so many things. It's going to be simple. You could just check out the introduction, right? We're going to talk about the introduction, what is sexual health, common sexual health issues, preventive measures, recognizing symptoms early, regular checkups, and so on. Well, before we dive into our class, I would just like to talk about myself a little, right? Um, just to give a little background about myself, I am a registered nurse and a digital health specialist with a very strong passion for reproductive health. That's why I'm here today, right? With a very strong passion for reproductive health, right? And I have actually dedicated my career to empowering individuals, particularly young adults like you and I, basically, so that we can have informed decision. It's very important. I don't want us to miss it. It's so important, right? Okay, I had to just cut some of the parts so that I don't bore you with my introduction, but basically just to let you know, I've been into digital health for quite some time too, so I'm a digital health specialist. Okay, so are you ready? If you're ready, just type something on the comment section, so we'll just dive into our class today. Just type in ready, 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 ready. I'm not saying that though. If you don't do that, we are not leaving. So you better start doing that now. Start doing that now. Are you ready? Thank you. Agnes, it's like you're the only one following me. All right, beautiful, beautiful. So let's just dive into our class today. Now we're going to be talking about introduction to this topic. Introduction. Now, sexual health. I'd like to ask us, if you are following, what is sexual health? Hmm? Or should we even just go before we ask what is sexual health? Let me just take a little preamble, right? Sexual health or and reproductive health, basically, there are so many things that encompasses, but I had to put them in bullet points for us to understand. Now, sexual health is a vital part of our overall, health and well-being. Truthfully, I will tell you that you should just put that in mind. Um, as a reproductive health professional, throughout the course of this lecture, I aim to provide you and I, even me that I'm here to, I'm going to provide myself with knowledge that we need to make sure that we have informed decision, because one of the major things that happens to young adults is the fact that we are not informed, so we don't make decisions that are right. We make information, we just do things that are not even supposed to be done, right? So during the course of this lecture, I'm going to make sure that we have informed or make informed decisions to be followed. Now, also sexual health encompasses. Oh, please go back to the. Thank you. Now, sexual health encompasses a whole lot, both physical, emotional. Remember when I was telling you that sexual health is not just about sex, sex, sex. It has to do with your emotional being, your mental health, your social aspect of your life. It has to do with a whole lot, not just about sex. When we talk about sexual health, so many persons, thank you, so many persons focus only on sex. When we talk about sexual health, it's a whole lot, right? Thank you. So the question now is, what is sexual health? We are going to the next one. What is sexual health? What is sexual health? Now, sexual health is something that, like I said earlier, we try to shy away from, but we shouldn't shy away from it. In a simple definition, right? Sexual health is a state of physical. Please, if you have your pen, jot this thing down. Sexual health is a state of, physical, emotional, and what social well-being in relation to sexuality. In relation to sexuality, please. So anytime you hear about sexual health, the reason why I am a little bit focused on reproductive health is this. People see sexual health as they just see sexual health as a taboo. It's more like a taboo topic. People don't like talking about it because they don't know what it entails. Sexual health entails so many. It has to do with the physical, emotional, mental, and your social well-being as relation to sexuality. Okay, so please let's try as much as possible not to run away from sexual health. Now, it also requires positive aspect or positive what's it called now. I'm looking for a special way for you to get it. As I wrote it on my slide, it requires positive and respectful approach to sexuality. Now, because we know what sexual health is, we don't most times we don't even do what we are supposed to do. We feel like sex is sex. We just go in and have sex because sexual health. We are focused on sexual health. All right. So let's try as much as possible not to just go that way. It requires positive and respectful approach. Please, sexuality is not is something that we're going to talk about maybe some other time. I'm invited here. Okay. Now, let's talk about some common sexual health issues. Some common sexual health issues. Now, there are a whole lot of sexual health. I just picked some common ones, right? Sexual health issues. If you are following, please just type it down on the comment section. Because of time, I'm not going to talk about the so many. I'm going to be picking just very few. Now, we have things like STI. We have STI, which is sexually transmitted infection. Now, infections that are spread primarily through sexual contact, they are called STI. Okay. Now, one of the common sexual health issues that we have is STI. Basically, they are transmitted. Some persons, when we have this, some persons will tell you that they are having. I laugh a lot when I hear this. When they go to probably they feel somehow and they go to like the chemist. The chemist will now tell them that they have toilet infection. Meanwhile, they have STI. Now, there's no such diagnosis as toilet infection. There's no such diagnosis as toilet infection. I tell you the truth. So please and please, I'm even using this moment or medium to say, please, if you feel funny, you could go to the hospital. Now back to our topic. Now, one of them is STI. We know that the primary contact of having this particular health issue is sexual health or sex contact or sexual contact. Do you get it? Okay. Now, another one that could, come out is unwanted pregnancy. Unwanted pregnancy, and this can occur, when you don't use contraceptive method or once your own fails. Okay. Other health issues that can, come up is, healthy relationship. It can give you issues in your relationship, when you don't have a good communication. You don't respect your partner. See, one thing that this can do is it can break your home. So that's why I said healthy relationship. I'm bringing some issues. You see that the issues now, they are not all related to having infection. Sexual, like I said earlier, encompasses so many. If you see now, we've talked about STI, which is the infection now. We've talked about unwanted pregnancy. We've now come down to talking about relationship, how it can affect your relationship, how it can affect my relationship. Now, another issues that can even pop up is consent. Consent. When both party don't agree, it might lead to rape. Do you see? Do you understand now? Thank you for following. Just keep typing so that I know that you're following. All right, now let's talk about preventive measures. There are a whole lot of preventive measures out there, okay? But because of the course of our lecture, I'll just be talking about a very few ones. All right, preventive measures. Preventive measures. Somebody write on the comment section and say preventive measures. Write on the comment section and say preventive measures. Make sure you are sharing this live video, please. Make sure you are sharing this. It shouldn't be just the both of us that are watching ourselves. In fact, do that now. Share this and come back. I'll not go nowhere. I'm going nowhere. Share this and come back. Share this and come back. I'll wait for you. Share this and come back. I hope you are sharing this. So I'm waiting for you. If you have done that, come back to the comment section and write done. All right. Beautiful, 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 beautiful. So let's move on now. Now you are following. Thank you. Thank you, Agnes. I can see you. I can see you, Peculiar. I can see you, Morayo. All right. So going back to our preventive care, going back to our preventive care or preventive measures. Now, safe. One of them is safe sex practice. Most of the young individuals they don't practice safe sex. Most young adults don't practice safe sex. We allow ourselves to be carried away with a whole lot. Okay? We allow ourselves to be taken by a whole lot of stuffs. Safe sex is one thing that we underrate, but can save you a whole lot. Now, the use of condom correctly. See, I still say this again. So many of the young male out there don't even know how to, rightly wear the condom. They don't know how to use the condom consistently. Now, this can be a problem to you. So, the use of condom has different ways, but I'm not going to talk about that now. Maybe if you have that question, you can put that later on the comment section. God bless you, Peculiar. You can put that on the comment section later after this class. Okay. I'm not talking about how to wear condom. I'm talking about safe sex. Okay, so we don't practice safe sex, and it can affect us in different ways. So one of the preventive measures that you can have is one of the preventive measures you can have is the practice of safe sex. It could help you a lot. It could help you. I tell you, it could help you. Right. The next thing that should be on your mind is to be tested regularly for STI. Remember when I told you that one of the complication or the health issues that can come out from this is STI, which is sexually transmitted infections, right? If you can remember. Now, I'm telling you now that another problem that can result as a problem from this is what? STI. And how do you know that you have STI if you don't test for STI? So you go for regular testing to be sure that you don't have this. Because when you don't treat yourself on time, in fact, one of the good thing about getting tested early enough is that it helps you to, if you see any infection, it helps you to fight or combat that infections on time before it even pops up. Do you know? Now, once you don't even know and you just leave it there and you say you feel like you're okay. See, there's some infection. Now let's use this moment to talk about that. There's some infection that would not ever tell you that it's coming. You might not even see the sign, oh. You might not see the symptoms. You might not even feel anything around. Not until the infection is on its last stage. And everybody's body is different. The way my body reacts to some illness might be different from the way another person's body reacts to some illness, right? So one person might just have gonorrhea, for example, and the person don't feel it or have any symptoms till it's on its last stage. And imagine when a disease is on the last stage, you know the kind of way it would be, right? Right? So please, it is important that you get tested regularly for STI. Now, another thing is vaccination. Now, for females, please, or in fact, all of us, but I'm more focused on the females for this now. The HPV vaccine, which is known as the human papilloma virus, it is important that I think okay, I will talk to our host for today, and then probably give him some information. I think there's a free test somewhere in Lagos State. I will talk to our host on that. So it is important that you get vaccinated for HPV. Okay, it is one of the preventive measures that you can use. Another way to prevent it is open communication. I know many of you will not agree with me. Don't be for anybody. I don't you don't you don't agree with me, but then one of the easiest way to prevent something is to have open communication. That's why it's important that you talk before you rush into having sex. It is good that you have this communication. But that's why I talked about safe sex. If you can remember, the first thing on this. Now, safe sex is not only the use of condom. Now, safe sex is about making sure that you are collected consent. Now, how do you collect consent if you have not communicated? So during communication, this is where it happens. Now, if you feel like you have an infection or you have something, that is when you even need to even talk to, so that your partner would know that okay, this person said this, this person said this, and let me prevent this thing. Okay, so communication is important. Let's quickly go because there's no time. Time is fast spent. Now, the other thing I'm going to be talking about is regular checkup. Regular checkup. We are not going to waste time on regular checkup, right? We are just going to be very fast on this. Okay, sorry. Recognizing symptoms early. That's our next point. Recognizing symptoms early. Now, how do you recognize symptoms early? Since remember when I talked about I talked about STI, remember, right? Recognizing symptoms early. Now, common symptoms of STI that we know is, unusual discharge, itching around your vagina or your penis, your private parts, basically, for both male and female. When you are having difficulties urinating, you are feeling pain, and sometimes when you are even urinating, you would shout and shout and shout and shout, and then rashes around your perineal area. These are one of the common signs or symptoms of um, STI. So it is important that you recognize this thing on time and then go and do your checkup. Is important. Okay. Now, one of the importance of early detection. Remember when I was talking about this earlier before now. One of the importance of early detection is that it helps also prevent complications that would give us issues. It helps us to prevent it. Another thing I would advise you to do, I'm trying to be very fast, is to know when to seek a medical advice. Know when to seek a medical advice is important as well. Now, if you notice anything that is not normal in your system, you could just immediately go and see a healthcare professional. Please, I'm saying this because I have a personal patient some time ago. In fact, I'll just share the story here. Um, she she did septic abortion, right? She went to do an abortion somewhere, and it wasn't done sterile. And when she came to the hospital, I think about 3 months after she did that abortion, I'll tell you why it's important to go and do this. I'll relate it to it. 3 months after she did the abortion, right? She now came to the hospital to, of course, checked on her, and in fact, we had to prepare her for immediate. I'm telling you, for immediate um, removal of her uterus. That's her womb. Now, because there was pus, so much pus around the uterus. You know what pus is? It was smelling. Now, one of the biggest complication, hmm? one of the biggest complication is of STIs. It can damage your uterus. You might not be able to give birth for life, and that was how that lady, in fact, she's a girl, she's not that old, was unable to, or is unable to, or would never in her life again give birth, without uterus. Okay, so it's important to know when to seek advice, medical advice. After this class, I'll drop my number at the end of the class so that you could reach me in case you have issues as well. So moving on, regular health checkups, regular health checkups, regular health checkups. Now, one of the things that is quite essential for maintaining sexual health, this thing includes STI, pap smear, breast cancer. For male, you could do there's what we call urinary tract analysis for the male. It's also important that you do it. You see, for the fact that you have engaged in sexual activity, eh, whether protected or not, it is important that at least you go to the hospital. That takes us to the number two bullet I have on the screen right now. That takes us to number two. That takes us, you do at least 3 days. I'm saying 3 days. I'm not seeing anybody commenting on the comment section. Let me know you are following. Let me know you are following. Because I said 3 days, I was expecting somebody to say, "Why 3 days is too short? It's too short." Is anybody following at all? I want to be sure. I'm waiting for you. Until I see a comment, I'm not moving on again. Okay. All right then. Thank you, Agnes. All right, okay. Right, I said 3 days for a reason. I wanted to get a reaction from you guys. Now, it is recommended at least that we have this test done, at least every 3 months. At least every 3 months is important. Or probably if your doctor has said that due to this condition, it is advised that you do every month. Some will say every 6 months, depending. If your doctor has instructed you to do a particular routine, then follow through. But if you have engaged in sexual activity and you are not too very sure, I would advise that you do at least 3 months. Every 3 months, it will help you to check. Okay. Another one that I would advise the ladies to do is pap smear. Pap smear is like, you know, um, 3 years. Yes, 3 years. Every 3 years, you could do that every 3 years. Now, except you are underage, except you are probably around 16 to, which I don't really advise you to, get into it on time. Except you are between the ages of 16 to like 20. But from 21, it is advised that you do this 3 times every year or 3 times a year. I don't know how you want to do it, or every 3 years. I don't know if it's making sense. Okay, I know you. I know what will come up on the Q&A time. So another thing that I would want to talk about is healthy. I'm trying to be fast. Okay, so I'm sorry if I'm being too in a hurry. I'm trying to be fast. So sorry. Another thing that we are going to be talking about is healthy lifestyle choice. Healthy lifestyle choices. Earlier today, I was talking to my PA, and she told me something. In fact, I didn't even know on time. She it made me laugh. It made me laugh. She said that she took I've forgotten the name of. Okay, I don't want to give any free advert. She took a particular thing and she has taken it more than 3 times. Sorry, more than 5 times in this week. Since last week, sorry. Since on Thursday down to this day. She has taken more than 5 times. And I've told her before that can affect the way menstruation will flow. Now, why am I bringing it now to us is that there are some lifestyle choices that we can take that would affect us. In fact, one of the biggest issues that we face later in our life is as a result of unhealthy lifestyle that we have kept or we lived or we are living. Okay, that's one of the issues that would even take us. No jokes. So it is important that we live a healthy lifestyle. I just wanted to, chip that in before I go deep into what we are going to talk about into healthy lifestyle. Now, I'm not going to pick them. I'm not going to read everything I have here. I'm just going to take them one after the other. I'll talk about diet and exercise. Now, if you remember when I talked about my PA, right? If you eat well, if you eat well, you won't have issues. If you eat well, you won't have issues. I tell you, um, if you are eating the right food or a balanced meal, you'll be okay. Mental health also, when you are managing your mental health, make sure that you are doing it the right way. Okay, make sure you are doing it the right way. Then the last thing I think I need to talk about, and I'll take time in explaining this: substance abuse. Now, most especially the guys, they have found themselves in a situation whereby they um they abuse drug before they even want to have sex. You see them taking this bitter, take another bitter, take another mixture, take another. In fact, substance abuse. In fact, once you do this, I'm telling you now, as a reproductive health expert, you are going to cause a problem to yourself in the next 10 years from now. Blood might not be flowing down to your penis anymore, or if it flows there, it will flow for just a little time because you have so much abused your liver, you have abused so many things. I don't want to go deep into it. So once you don't live healthy, you can have problems in the future. Okay. Now another thing we are talking about is emotional and psychological aspects. Remember when I defined what sexual health is? I told you that it's a state of your mental health, is a state of well-being when it relates to sexuality, right? So it also has to do with your emotional aspects. We can't just talk about sexual health without talking about the emotional aspect of sexual health. So basically, I think I'll be very fast too. I think I have a call. Okay. Um, Emotional health. When we're talking about emotional health, it has to do with dealing with pressure. It has to do with healthy relationship. Remember when I talked about it before, and also has to do with self-respect and setting boundaries. Okay, because I think I found out that a whole lot of ladies. Sorry, can you are saying something? Are you saying something, Mr. Prosper? I can't hear you. Is it me, Mr. Prosper? Are you talking to me?
All right, I said you can go ahead. Just after this, we get into the Q&A session.
Okay, 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 okay,
Okay,
okay.
okay, 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 okay.
All right then.
All right then.
No problem. All right, we have the emotional aspect of it. I'll be very fast so that we'll just go to the Q&A section. So we have self-respect and boundaries, healthy relationships, dealing with pressure. I've said that before. Uh, Another thing we should do is to educate ourselves. Right? We should educate ourselves. It's important for us to educate ourselves. Now, before we go, I would like to have this with us. You know, every young person deserves the knowledge and skills to protect their sexual health and make informed decision for a healthy future. It is important. I said this because it is important for us. I don't want to bore us with too many talk. Now, I know that you are following. No need for me to ask you again. Now, you need to overcome stigma. Okay, overcoming stigma is one thing that we don't talk about. Sexual health is one thing that people try to run away from, and that's why we are doing this today. People try to run away from sexual health or discussing anything related to sexual health, and it's not even good at all. Please, Now, I will just take away this. After this, I will drop the slide with our uh, our hosts for today. Probably you can share it with everybody. So now is our Q and A section.
Can you hear me?
Yeah, yeah, okay, you know.
All right, so that was an awesome session. I personally learned a lot of things, and I think our audience have learned a lot too. And so we're going to be entering into the Q&A, just like I said. Yeah, so there's so many things you've talked about, and I'm sure they are taking notes. Now, the first question that have actually come up several times is talking about people who are not sexually active. You know, how they are to what do you say to them about their sexual health? Because there have been stories of people who take certain herbal medication, especially for the ladies. They take certain herbal medications. They say they are trying to treat the so-called toilet infections. You know, these people are not sexually active, but they are taking certain herbal medications for the guys, for the girls, you know, doing several things. I really want you to zoom in for people who are not sexually active, how to go about their sexual health. Because some of these actions they take affect them on the long run, even you know, it may even make them not be able to conceive, you know, just damage some things on the long run. So yeah, take it away for people who are not sexually active.
I was muted for a while. Sorry. If you're not sexually active, I would like to do this. Yeah, you are really trying, and it is important that you just keep to that way. Now, if you're not sexually active and you find yourself having some so-called toilet infection, I'll come back to another thing later. So-called toilet infection. It is important that you also go and do regular checkup. Now, it might be that as a result of, for the ladies most especially, as a result of wearing tight underwears, right? Your pubic area might be moisty, and when it's moisty, it can bring up yeast infection, because yeast infection thrive in an environment where the everywhere is moist. Now that can give you yeast infection. Only wearing tight thing, and when you're wearing what is not even dry, when you're wearing your boxers or you're wearing panties that is not even dried, that is not dried completely, it's also moist. Yeast infection can grow from there as well. Okay, there are so many persons that have a very bad habit of wearing. They wear panties. In fact, they wear pad. After pad, they wear panties. After pad, after panties, they wear tight. After that tight, they will now wear trouser. Do you want to kill yourself? So you can also have something from this I've just made mention now. You can have issues from that. So try as much as possible to allow air to go inside your private part. Allow air to go in and go and do checkup. If you find out that you have this, try and live right. I'm telling you the truth. That's just it. Just try and live right. Keep keep a very good hygiene, a good hygiene, and you'll be fine. I can't hear you, Prosper. I just want to know if you heard what I said before. I will answer this. I will answer this. Just
All right, okay. Then from the I think from the community. By the way, thank you for that awesome take on that of people who are not sexually active. Yeah, that's an awesome take. But I still need you to seem to miss an aspect before we get into this last question. I think if anyone else. Okay. For those people who use herbal medication, actually, I've heard a lot. Okay. People use several things. They say use salt, use this, use that. You know, wash the privates, do this and all of that. What do you have to say to them? And that is something that people actually do, and they believe that these things are potent, and sometimes they're retarded parents or you know uneducated guardians guide them into these practices. And, you know, yeah. So, what do you say to to them.
Okay. Um, sorry, I missed that. I got carried away. Most times when I hear right, this is it. If you have found yourself or you know somebody that is using herbal medication, or you know some persons that like to put, I've said this countless times, that likes putting stuffs in their vagina because maybe I don't know if your vagina is a warehouse. It's not a warehouse that you be keeping stuffs. It is not good in any way. Anything that the doctor does not recommend, anything that the doctor did not say you should put or should not say you should drink, don't ever try it. That's just the truth. I don't want to beat around the bush. For you taking herbal medication, you are putting yourself at risk. You are putting your liver, you are putting your kidney at risk. These two organs are vital for you. You are putting them at risk first. And then for all those people that would buy whatever tightener you want to buy, you buy this tightener, you buy this other one that would make water flow down there. In fact, those stores might later have issues, right? You might see, in fact, they have a whole lot of ladies now that are having cervical cancer. And now the reason why they're having this cervical cancer is not because they have it genetically. This is because of the stuff that have been packing into their system. Okay, so try as much as possible not to. In fact, if you know anybody that is doing this, tell the person to avoid, please.
Right, thank you so much for that one. Thank you so much for that one. That was not so, I think we will answer this last one. I think we're focusing so much on the ladies and the ladies and the ladies. Yeah, we have issues on that regard. But then I want to say something for the guys too, probably those who are following, and for them before we get to this.
Okay. Now for the guys, I'm so sorry. Please forgive me. I deal with a whole lot of ladies, a whole lot of ladies. In fact, in a day, as I'm talking to you, I'm still in the hospital. So forgive me, please. It's not like I'm trying to take you guys away. All right, for the guys, if you find yourself, especially those that find themselves taking whatsoever bitter before they want to have sex, or even if you are not sexually active, you feel like taking bitters or taking whatever helps, it doesn't help you. Like I said to the ladies, whatever the doctor did not say you should take, don't take. Whatever they don't recommend for you. In fact, the only thing that you should find yourself doing in the pharmacy is only when they ask you to go and buy those drugs. And if you are going to the chemist, it is only over the counter drugs that you should take. Example of over the counter drugs that you should take is paracetamol. And in fact, do you know that when you abuse paracetamol, it can give you liver problem? As small as paracetamol is, it can give you liver problem. Not to talk of those herbal medications or those different medications that will say you should take for this to last for 24 hours, to last for 15 hours, to last for. Please, it's no good. Please, I'm begging you. I'm begging you. You might have erectile dysfunction. The reason why some persons are having erectile dysfunction is because of alcohol, due to some drugs that they have taken, illicit drugs. Even as far as shisha. I know so many persons will tell you that they don't smoke, they only take shisha. As far as shisha, when you take shisha consistently, it can lead to that. Okay, please avoid it, please, please.
All right, all right. More questions are just coming up. I don't know. We really need to wrap up. It's almost 8. So I wanted to merge these two questions. You answer this one I'm going to ask right now, and then you answer the person that wrote the question in the comments. So you talked about people who take drugs and all of that, to last extended periods of time and all of that. Now, I've gotten this question a couple of times about people who probably have been exposed to a lot of false information about sexual durations, and probably they are into pornography and things like that. Now they become anxious that, look, I don't know if I can pull off what these people are pulling off. I don't know if I can do it. I don't know if I can do this and all of that. When they don't really know that, that is acting and all of that. So I want you to say something to them to protect their, what should I target now, mental health toward their attitude toward sexual health. And then we answer these two questions. There are two questions here. Just mark it. We should wrap up before 5 minutes after 8. Let's call it 9.
All right. Now, if you have been, I'll try to be fast with answering the very first question. If you have find yourself in a sport where you are addicted, or you've seen too many pornography, and it's affecting you, or because of the too many pornography you've seen, it is affecting your sexual health, there's something that you can do. First off, try as much as possible. I'm trying to be calm in saying this. Try as much as possible to avoid seeing the too many pornography. Just try as much as possible to imagine yourself living free. That's the first place you need to start from. Start seeing something else. I wouldn't want to even advise you to go and have sex first. Now, we don't do that. When you find yourself in that condition, the very first thing that you should do, you should try, because it's not easy. When some persons are addicted to a particular thing, what we advise them to do, if we'll try as much as possible to know the time frame. Okay, if you know the time frame or the time you dedicate to even seeing pornography, we can say, okay, if you see pornography in a day for like 2 hours, try as much as possible to limit it now for maybe 1 hour. Now, from 1 hour, you limit it down to maybe say 30 minutes. From 30 minutes, 15 minutes, just like that, we take it off first. Now, in doing this, I would always advise. I'm a Christian. I don't know if any other person here is not a Christian. Forgive me, but I'm a Christian. I'll talk with my own faith, right? I also advise that you have a spiritual father that you can talk to as well. I know you would want to say nurses or doctors. We can prescribe, but it is important when you're having some issues and you talk to somebody that is elderly to you. Sometimes it commands this respect. It is very important too. So doing that will help you. Then progressively, what you should do, because of your mental health, look for somebody to talk to. Look for somebody to talk to that you can communicate with, because in fact, Mr. Prosper, I want to digress a little. Sorry for this, please. I had a patient that was I think 3 months ago. This same issue, she was having the same issues. She doesn't enjoy sex with her husband no more. Now, this is due to a whole lot of pornography that she has seen, as she said. uh, do you know what's in fact, she just, according to her, she just allows her husband to just do and then stand up, to the point that she got tired and she had to come to the hospital. Now, what we actually did for her was this: try as much as possible to, if you are married, to pray, love your husband, take those things away, and then talk to someone. If you have to talk to someone, talk to especially health experts or somebody that is related to reproductive health. They have some techniques that they will give to you. We have some, we call it 22 technique. 22 technique. We are going to do 20 things and then do two things, do 20 things and then do two things. It's a technique that we have. We can always share anytime I have someone to talk to. Because of time, I'll try to wrap up with this. Okay. Now let me answer the other person that said toilet infection. Please, there's nothing. I said it. There's nothing. There's no diagnosis in this world that is toilet infection. There is no diagnosis anywhere that is toilet infection. So anybody that tells you that you have toilet infection, the person has lied to you. Okay. Please, sir, is it advisable to be taking infection drug during period? All right. Now, is there anything like infection drug? You should ask yourself this question. There is no such thing like infection drug. There's no such thing as infection drug. In fact, because of this, I think most ladies or even men generally, we've abused antibiotics to the point that it is no more effective in our body again, because we have overused it. We have overused it. So it is not advisable that you take drugs that was not prescribed or is not prescribed to you even during your menstruation. ask your doctor, ask the person that prescribed, please, is this drug okay while I'm on my menstrual period? There are some drugs that you can take, but there's no drug as infection drug. So don't go to the pharmacy, don't go to the chemist and tell them to give you infection drug. Instead, go to the hospital. They will conduct series of tests. And after that test, before they can get a diagnosis to now say, okay, this is the problem. And once they do that, once they tell you the problem, they will see a particular drug that is sensitive to you. All right? Thank you.
All right. Thank you so much, Collins. I think this night was a blast. We shared so many things, and I believe our audience learned a lot, and their minds have changed for what they've been doing, and I'm sure they're going to turn a new leaf. All right. So you shared a lot, and I know there's still a lot in reserve, and couldn't share now, and a lot you didn't say. Because it's just a 1 hour session. So how can we stay in touch with you? How can they stay connected with you, your social media handles, and
The very easiest way to connect with me is I would share my email address. You could reach me at notcollins@gmail.com. Not okay, Collins, NURSE. Or give me a moment, please, Mr. Prosper. Can you just put on my slide? I think I have that on my slide. Yeah, these are my details. If you have any issues, you could just probably screenshot or save the numbers. You just have it and then contact me. That's how to reach me. I also have like a personal one-on-one coaching section with my people. So if you want to have that as well with me, you could also reach me on that. And I promise, because I'm very tired, as you can see. I promise to come back again to do something on this. It's a promise. Today I've been exhausted. I won't lie to you. Thank you.
So so far we've really learned a lot, and we've really come to the end of our session today. Even though we didn't really scratch the surface, because the surface of sexual health is just a lot to unpack. There is a lot to unpack, but here we've gotten a head start, and of course, just like we started, it's all about preventive care. You don't look for things to happen before you start running around. You have to proactive. It's being proactive for yourself, especially yourself. Avoid problems for you now. And so you within a more clear life. So thank you for being on here. The video is going to be on our Facebook page, and we are also going to upload our YouTube page. So thank you for being on here. We are always there to help you. Also help you always stay robust. Thank you, Nurse Collins, and we're probably going to bring you on here some other time. And thank you so much. I really appreciate it.
Thank you so much. I really appreciate it.
Thank you.
All right.
All right.